Promised earlier on, we will be going to Geneva, Switzerland. There's Dr. Tedros there already, the director of the World Health Organization, addressing us as we've become quite used to during this COVID-19 pandemic.
Support for WHO and for eliminating the shadow in blue in honor of WHO and the United Nations. But although new cases here in Geneva are now in the single digits, we're continuing to see an escalating pandemic globally. As the pandemic accelerates in low and middle-income countries, WHO is especially concerned about its impact on people who already struggle to access health services, often women, children, and adolescents. The indirect effects of COVID-19 on these groups may be greater than the number of deaths due to the virus itself. Because the pandemic has overwhelmed health systems in many places, women may have a heightened risk of dying from complications of pregnancy and childbirth. WHO has developed guidance for health facilities and community activities on maintaining essential services, including for women, newborns, children, and adolescents. This includes ensuring women and children can use services with appropriate infection prevention and control measures and respectful maternal and newborn care. WHO has also carefully investigated the risks of women transmitting COVID-19 to their babies during breastfeeding. We know that children are at relatively low risk of COVID-19, but are at high risk of numerous other diseases and conditions. Children are at relatively low risk of COVID-19, but are at high risk of numerous other diseases and conditions that breastfeeding prevents. Based on the available evidence, WHO's advice is that the benefits of breastfeeding outweigh any potential risks of transmission of COVID-19. Mothers with suspected or confirmed COVID-19 should be encouraged to initiate and continue breastfeeding and not be separated from their infants unless the mother is too unwell. WHO has detailed information in our clinical guidance about how to breastfeed safely. WHO is also concerned about the impact of the pandemic on adolescents and young people. Early evidence suggests people in their teens and 20s are at greater risk of depression and anxiety, online harassment, physical and sexual violence, and unintended pregnancies, while their ability to seek the services they need is reduced. School and university closures can also have a dramatic impact on the ability of adolescents to access preventive services. In some countries, more than 1/3 of adolescents with mental health conditions receive their mental health services exclusively at school. Millions of children who are fed through school meal programs also have reduced access to food. Limited opportunities for physical activity and increased use of tobacco, alcohol, and drugs may have impacts on the long-term health of these young people. To address these challenges, WHO has developed guidelines on maintaining essential services, which we have discussed before. There are also many things people can do to take care of their own health, like staying active, eating a nutritious diet, and limiting their alcohol intake. New products, information and technologies are changing how health services are delivered. Increasingly, some medicines and tests can be safely obtained over the counter at pharmacies or can be prescribed by doctors online and delivered to people's homes. WHO has developed guidance on self-care interventions for health, which can be rapidly introduced in countries to save and improve lives. For example, providing women and girls with self-injectable contraception can greatly reduce the burden of unintended pregnancies. Access to treatment for people living with HIV and medicines for other health conditions that people can self-manage can reduce the burden of overstretched health systems while meeting the health needs and rights of individuals. Self-care interventions enable more people to obtain the health services they need during the pandemic, when and where they need them. It's our collective responsibility to ensure these interventions are available and accessible to all people who need them. To talk more about the impact of COVID-19 on women, children, and adolescents, today I'm honored to be joined by 4 distinguished guests. Natalia Kanem, Executive Director of the United Nations Population Fund; Gabriela Cuves-Baron, President of the Interparliamentary Union; Jayatma Wickremesinghe, the UN Secretary General's Envoy on Youth; and Mary-Ann Etiebet, the Executive Director of Merck for Mothers. And I would like now to give the floor to my sister, Natalia. Please, you have the floor.
Thank you very much indeed, Dr. Tedros, and greetings to all colleagues. UNFPA is proud to host Every Woman, Every Child. Now in its 10th year, EWEC has galvanized political momentum. Its Women Leaders Roundtable advises on the immediate actions we need to protect hard-won gains on sexual, reproductive, maternal, newborn, child, and adolescent health. Today, I'm here as a doctor leading and speaking for UNFPA in the interests of women and girls facing COVID-19. It is a very serious situation, and action is a must because the realities and the consequences of inaction have never been so stark wherever maternity and child health services are not functioning or only partially functioning. In over 150 locations around the world, every day UNFPA reaches out to women and girls with reproductive health and violence protection services, bringing to life the care, including in humanitarian settings, through the rapid response mechanism UNFPA leads. With COVID-19 affecting health systems, many pregnant women are being cut off from reproductive health care. Many thousands could die from preventable complications of pregnancy and childbirth. Women like Zainab, she delivered a daughter at home with absolutely no help. There was no midwife, no doctor. The maternity facility closest to her is closed down. And sadly, Zainab hemorrhaged to death after the birth. We must do better. Pregnancies don't stop for the pandemic. Sexual and reproductive health services are not just nice to have, they are essential. Even before the emergence of COVID-19 for millions of women, timely, high-quality maternal health care was unavailable, it was inaccessible, or it was not affordable. And now, with the pandemic, we're seeing exacerbation of already limited access to care, putting women's health and lives at risk. UNFPA has shown that for every 6 months of curfew, lockdown, disruptions, some 47 million women will lose access to contraception. This would result in an additional 7 million unintended pregnancies during that 6-month period. Progress on children's health by the year 2030 is equally threatened, with an estimated 13 million more child marriages over the next decade and an additional 2 million incidents of female genital mutilation. So what can we do? We can act, and act swiftly. Countries making sexual, reproductive, maternal, adolescent, and newborn health services universally available and declared essential during the pandemic. For UNFPA, the COVID response hinges on services and on data. First, uninterrupted sexual and reproductive health services, so midwives and other health personnel get the personal protective equipment, PPEs, that they need. Second, we are helping to keep the supply chain going for on-time delivery of contraceptives, maternity drugs. We're providing dignity kits with menstruation necessities and other reproductive health commodities. And third, and certainly not least, we are joining WHO and others in sounding a red alert to stop gender-based violence and to give timely assistance for women and girls who are now trapped in abusive situations because of COVID. It's truly an emergency, a pandemic within the pandemic. Everybody, men especially, has a special responsibility to stop gender-based violence in its tracks once and for all. So UNFPA, working with the World Health Organization and other partners to maintain supply chain continuity, to leave no one behind, using technology, telemedicine, hotlines, and certainly to provide mental health counseling. UNFPA is gathering disaggregated data to support governments to identify and reach those most in need during the pandemic, including elders and people with disabilities. During this first ever International Year of the Nurse and Midwife, UNFPA salutes the world's midwives. Dear midwives of the world, you are the unsung heroes on the front lines of this COVID crisis, and you're essential when it comes to maternal and community health services. To ensure safe pregnancies and births for everyone, everywhere, to provide contraceptive services and information to young people, to prevent unintended and teenage pregnancies, and to prevent unsafe abortion, all major causes of preventable maternal death. Every single day, midwives risk their lives to protect women and newborns. They urgently need and deserve protective equipment, just like other frontline workers. COVID-19 is devastating, yes. It's making the road to 2030 steeper. It's been the great revealer of deep-seated inequality. And yet, I believe the pandemic's effects around the world is giving us a unique opportunity to recast how we do things, to reimagine health systems, to recalibrate people-centered care, and as Secretary General Antonio Guterres says, build back better, with political leadership at the highest levels, with earmarked resources, with disaggregated data, and with hard work. I believe we can and we must build back better, with more resilient and inclusive health systems, so that our mothers, our sisters, our daughters, so that women will not die. Let us work in unity with AWEC during this crisis to assure that maternal health is prioritized. There's nothing more tragic than a woman losing her life as she gives birth. Tragic for her helpless newborn, for her family, community, and society as a whole. Let us be the generation that defeated COVID-19 and put an end to preventable maternal mortality within our lifetimes for every woman and every child. Thank you. Thank you very much, Dr. Tedros.
Thank you, Natalia. That was really amazing, and thank you so much for your message. And now to Gabriela Cuevas Baron, President of the Interparliamentary Union. Gabriela, the floor is yours, please.
Thank you. Thank you very much, Dr. Tedros. Thank you very much, Dr. Natalia, Hayatna, Marianne. Thank you very much for this opportunity of working together for every woman and every child. The COVID-19 pandemic is not only having a direct impact on those infected, but also indirect consequences due to the disruption of routine health services and far-reaching socioeconomic impacts, further exacerbating inequalities. Women are affected differently than men. 70% of health workers are women, and women make up the majority of carers at home, as well as workers in grocery stores or pharmacies, putting them at high risk of infection. Projections from the United Nations Population Fund, just as Dr. Natalia was mentioning, estimate that disruptions in sexual and reproductive health services could limit access to modern contraceptives for 47 million women and leading to 7 million unintended pregnancies. Also, a very important issue is that violence against women has already reached epidemic proportions in all societies, with 137 women killed every day globally by a member of their own family. The level of domestic violence and sexual exploitation further increases as a result of confined living conditions and economic stress. Children and young people are not put at the center of this pandemic, but they risk becoming the greatest victims. They are severely impacted by socioeconomic measures, with 42 to 66 million children who could fall into extreme poverty as a result of the crisis this year. Financial hardship for families and the closure of schools are expected to increase malnutrition, with long-lasting effects on well-being of children and young people. Young people, in particular, the most vulnerable, such as the young migrants, young refugees, young people with HIV, also have limited access to information, education, and social support services. To ensure that the pandemic does not disproportionately affect women, children, and adolescents, but also that we take this opportunity to build better and fairer societies, we need to ensure, first, that measures taken in response to COVID-19 protect and support the most vulnerable. As a parliamentarian and as president of the Interparliamentary Union, I know that parliaments have a great responsibility in this regard, and that they must be at the heart of the national and global response to COVID-19. We need to prioritize the continuity of services, including sexual and reproductive health services, immunization, and nutrition programs, ensuring access for all women, children, and adolescents. Also, we need budgetary oversight so that an effective response can be assured. As WHO has been mentioning, find, test, isolate, treat, and trace. It is also important that decision-making processes are inclusive. This means that we need equal representation of women in order for policies and strategies to be effective for those in greatest need. Ensure that health workers have personal protective equipment. Healthcare workers and first responders must be protected. And of course, they must also be protected against stigmatization and attacks. Address care work, paid and unpaid, that is largely performed by women. Apply a gender lens in the design of all measures to address the socioeconomic impact of COVID-19 to ensure greater equality and social protection of women who are more likely to have lower paid and to have less secure jobs. For this pandemic, we must not lose sight of the needs of pregnant women as a vulnerable group. We must care for them and for their babies. The IPU parliamentarians are committed to the implementation of the Universal Health Coverage Initiative. This initiative represents an opportunity to promote a comprehensive and coherent approach to health through health system strengthening. This initiative has its basis on the belief that all persons and all communities should have access to quality essential health services. Governments must ensure the safety and well-being of children. We have here a lot of numbers, but the reality is that we took children as a population that is already safe, and that is not 100% sure answer. We need to come with answers in terms of nutrition, in terms of health, in terms of schooling. It is also about their well-being. And as parliamentarians, our duty is to ensure that these problems are adequately addressed in legislation, as well as provide the means to do so through approval of budgets that can fund efforts into that direction. We need to ensure a comprehensive approach that goes beyond the immediate short-term response to the pandemic. Yes, it is very much needed. We need an answer and a solution for the pandemic, but also we need a plan. We need measures to address the root causes of gender and social inequalities that must be at the center of efforts by parliaments, governments, and all other actors during and after COVID-19. This includes addressing financial, cultural, and legal barriers to access health, improving nutrition and access to education and information, including on sexual and reproductive health and rights. The time for action is now. We have a collective responsibility to protect and promote the health and rights of all women, children, and adolescents. In the face of this pandemic, we cannot continue business as usual, and we must take this opportunity to finally drive the changes needed to transform our societies for women, children, and adolescents. From the Interparliamentary Union, we are fully committed on having parliamentary responses to COVID-19 and to build better societies after this pandemic. Thank you very much for having us and working directly with the parliaments.
Muchas gracias, Madam President. Now we proceed to the next speaker, and I have Jayatma Wikramanayake, who is the Secretary General's envoy on youth. You have the floor, Jayatma. Please proceed.
Thank you very much, Dr. Tedros. And with time, you have gotten so much better at pronouncing my surname. So congratulations on that. As you said, Dr. Tedros, we are all impacted by the COVID-19 pandemic, regardless of our age. And the health and non-health impacts of the COVID-19 on adolescents and young people are proving to be significant and long-lasting. The pandemic has exacerbated, as we all know, the existing vulnerabilities and inequalities, but we are also witnessing the fact that the impact of COVID-19 are and will continue to be felt most harshly by the adolescents and young people of this generation, already who are starting their lives in difficult or disadvantaged circumstances, like young refugees, young migrants, young LGBTIQ people, young people in detention, young people living with disabilities, young people living with HIV, and young people living in poverty are disproportionately affected. So I'll touch upon what are the impacts of health, particularly the impacts of sexual and reproductive health on adolescents and young people. Research indicates that children and adolescents are just as likely to become infected as any other age group and can spread the disease. Evidence to date suggests that children, adolescents, and young people are less likely to get the severe disease, but severe cases can still happen in these age groups, in particular for those with underlying chronic health conditions. So they should follow the same guidance for physical distancing, hand washing, and maintaining overall good hygienic practices, self-quarantine and self-isolate if there is a risk that they have been exposed or are showing symptoms. And I would like to reiterate the message to all the young people. The COVID-19 response is already putting immense stress on health systems around the world. It's disrupting the delivery of routine health services and information to young people, sharply limiting access to sexual and reproductive health services, disrupting immunization schedules, and cutting off young people's access to health services delivered through schools and universities, which are now shut because of physical distancing measures. So as the pandemic spreads to low-income and lower middle-income countries, which have disproportionately large numbers of young people and comparatively weaker health systems, direct and indirect health impacts on adolescents and young people will likely increase. With the observed disruption of health services, young people who need essential, time-sensitive, and life-saving medication and information services may be at risk of not being able to access them. For an example, adolescents and young people's access to sexual and reproductive health services is disrupted, which puts them at risk of unintended pregnancies, STIs, HIV, sexual and gender-based violence, needless to say that young women and girls are particularly vulnerable, as Dr. Natalia mentioned, the staggering projections in her remarks. 1.2 billion children and youth are kept out of school by the pandemic, and this means that they not only miss formal education, but also non-formal education, which they usually receive through community interventions, universities, school clubs, youth clubs, peer organizations and networks, and youth groups. So not having access to this information could seriously impact the choices they make about their lives and bodies today, but also impacting seriously their futures. And the second point I'd like to touch is on mental health. So before the COVID-19 emerged, the statistics on mental health conditions for young people were already stark. Around half of all mental health conditions start by age 14, and suicide is the second largest leading cause of death among young people aged 15 to 29. Now, because of the pandemic and the lockdown measures, adolescents and young people have limited access to positive coping mechanisms that they turn to otherwise in times of crisis. For an example, social initiatives, community service, voluntary service, formal and non-formal education opportunities, sports, youth clubs, or other types of physical activity. A study carried out with young people with a history of mental health needs living in the United Kingdom reported that 83% of the young people who participated in the survey agreed that the pandemic had made their mental health worse. A study done in Ethiopia in April 2020 reported a threefold increase in the prevalence of symptoms of depression compared to the estimates from Ethiopia before the pandemic. Parents in Italy and Spain have also reported that their children have had difficulties in concentrating, as well as irritability, restlessness, and nervousness. The stay-at-home measures have come with the heightened risk of children witnessing or suffering violence and abuse as well. In a webinar series called Coping with COVID, conducted by my office in partnership with WHO and UNICEF, we heard some dreadful stories from LGBTIQ young people who were forced to lock down with parents, families, and friends who do not accept them for who they are. And this is quite worrying. And a study published in the Journal of the American Academy of Child and Adolescent Psychiatry argues that mental health impacts may persist after the end of the lockdown measures as well. Example, social isolation and loneliness shown to increase the risk of depression, and possible anxiety at the time of loneliness was measured and between 0.25 to 9 years later. Therefore, the need for adolescent and youth-sensitive mental health and psychosocial services and counseling will increase and should increase the pandemic's as the pandemic progresses. So 3 solutions before I wrap up. First, the post-COVID response plans must be sensitive to adolescent and youth specific healthcare needs. This means developing and funding national plans that shift care away from institutions to community, youth-led, grassroots-led services, allow for outpatient services, mobile clinics, and peer groups, ensuring the coverage of all young people without discrimination. Second, governments and policymakers must ensure that within the context of universal health coverage, availability and accessibility of youth-friendly mental health services and youth-friendly rights-based sexual and reproductive health services and comprehensive sexuality education. Thirdly, governments and institutions need to see young people as partners, not as troublemakers. There are thousands of young people right now volunteering in the communities as frontline healthcare workers, as they're running hand washing campaigns, fighting misinformation online, they're innovating solutions. So make them your allies and make them your partners, support their work, create safe spaces for them, and invest in their work. So these solutions that we are proposing will last for generations to come. Thank you.
Thank you, and thank you for your kind words. And I would maybe add one more language from Sinhala to you for joining us. Obata stati. I hope it's correct. Stutia. Obata stutia. That
means... it's okay.
Thank you so much. So now we thank you, Jayatma. Thank you for your message, and thank you for your hard work, and we're really proud of you. And then the next speaker will be Mary-Ann Itiebet, the Executive Director of Merck for Mothers. You have the floor, Mary-Ann.
Thank you so much, Dr. Tedros. I'd also like to extend my thanks to the UN Secretary General Every Woman's Every Child initiative for the opportunity to contribute today and add to the perspectives and insights already shared by the other champions for women, children, and adolescents in this briefing. MSD for Mothers was created back in 2011 when our company made a $500 million commitment to help create a world where no woman has to die giving life. And MSD for Mothers is also known as Merck for Mothers in the US and Canada. And I'd like to thank Dr. Kanem specifically for sharing so eloquently just what is at stake here when it comes to maternal mortality. The COVID-19 pandemic threatens our shared vision for helping end preventable maternal deaths. In the worst case scenario, a recent publication in The Lancet estimated that COVID-19 in the next 6 months alone could result in the deaths of over 1 million children and over 50,000 mothers, all due to indirect causes or all due to the indirect impact of COVID-19 and the reductions in utilizations of essential services. We are all living in that worst case scenario right now. And I want to share 2 examples from Nigeria and India, since together they account for over a third of all the global maternal deaths we see. In May, the Nigerian Ministry of Health reported that antenatal care visits and child immunization visits had dropped by about 50%. Skilled birth attendance was also dropping by almost 40%. And data from the Indian health management system also suggests that in March, after a nationwide lockdown was enforced, institutional deliveries dropped by 43%. We have already learned from the affected West African countries how Ebola wiped out 28 years of progress towards maternal, child, and adolescent health goals. We cannot afford to look back on the next 10 years as a decade of picking up the pieces and rebuilding trust in the ability of health systems to deliver on essential services for women and children. We need, rather, to look back on the next 10 years as the decade of accelerating action because we all came together to do this. We need to recognize that funding for essential services for women, children, and adolescents will continue to come under increasing pressure. But we can build on pre-existing institutions, including those like the World Bank's Global Financing Facility, whose core mission is to ensure sustainable health financing for these goals. MSD for Mothers is proud to be part of the GFF, which is currently supporting 36 countries to scale up access to comprehensive primary healthcare services, which are critical for effective pandemic preparedness and response. COVID is also teaching us other hard truths. It has exposed societal fault lines around gender, racial, and ethnic inequities, and our inability to deliver on essential services for the most vulnerable, marginalized, or disenfranchised is not just a reflection of the fragility of our health systems. It's also a reflection of our societal values. We need to ensure that in our responses to COVID, we do not exacerbate inequities in health outcomes, including those inequities we see in the US and around the world due to systemic racism. As the global community mobilizes action against the pandemic, we need to recognize that it is not just about making the right decision for the moment, but it is also how we make the right decision in the moment for the future. We will need multi-sectoral partnerships. We will need to support an innovation ecosystem. And we will need to remember that health systems should not end at the facility, but they should end with the person, wherever they may be. Regarding that first point of ensuring that we are leveraging the strengths of all sectors to augment government responses, one potential solution includes leaning into the capacity of local private sector, whether it be the local private providers, the physicians, the nurses, the midwives, the supply chain distributors, the lab techs, who can help deliver healthcare. Or whether it's leaning into social innovators who are creating digital solutions so we can better communicate with patients. And even local industry who are helping to manufacture essential PPE that our healthcare workers need, 70% of whom are women. We are seeing this, for example, in South Africa, where the government is including local private sector in their strategic response plan. Partnership is critical in all we do. MSD for Mothers is a board member of the Partnership for the Maternal, Newborn, and Child Health Group, which is the world's largest multi-sectoral alliance for these issues, with more than 1,000 members and led by board chair Helen Clark, the former Prime Minister of New Zealand. We are all standing behind a new 7-point call to action to protect and improve women, children's, and adolescents' health, not just during COVID, but also beyond. And all of these champions in civil society, in government, the private sector, the health professional associations, youth groups, donors, academia, the UN, and more will all be gathering virtually at the PMNCH Summit in July to drive multi-sectoral action for women, children, and girls. Second, we need to support an innovation ecosystem so that we can accelerate the timeline to develop, deploy, and scale solutions. Solutions that are not only needed to control the pandemic, but solutions that can also help us deliver essential services efficiently, at a high level of quality, and at scale. Private sector will be an essential partner in this. And last but not least, COVID is teaching us that we must reach people wherever they are. Health systems don't end at the facility, they need to end with the person. So whether it's through those mobile units that Jayanthra mentioned, or through community health workers meeting patients in their homes, or through technology connecting with patients on their phones, we can learn from our responses during COVID to build back better patient-centered care. Together we can do this, building on the global solidarity that is already driving our COVID-19 responses, to build stronger, more resilient, more responsive, and more inclusive health systems that we can continue to protect and improve the lives of women, children, and adolescents. Thank you.
Yeah, thank you. Thank you so much, Marianne, and thank you to all again. Please, Tariq, back to you now for the next session.
Thank you, Dr. Tedros, and big thanks to all of our guest speakers. I understand they will stay with us for any possible questions, so I would really encourage journalists to take this opportunity to use the presence of our distinguished guests and ask questions on this particular topic. Journalists who are with us on Zoom can listen this press briefing in 6 UN languages plus Portuguese plus Hindi, and this is thanks to our interpreters who are here with us today, and we would like to thank them. Journalists can also ask questions in 6 UN languages and Portuguese, not in Hindi for the moment. So we will start with the questions. We expect everyone to be short, concise, and have only one question. So if we are ready from the technical side, we will start with the Shanghai Media Group, and we have Bin Chen online. Hello. Can you unmute yourself, please?
Yes. Hello, can you hear me?
Yes, now we can hear you. Please go ahead.
Okay, thank you very much for the special guest speech, but my question is not related to this subject. Sorry for that, but thank you for taking my question. So today, EU announced its plan to invest billions in purchasing vaccines from pharmaceutical companies in advance to secure enough shots for European citizens. while Washington indicated before also that it wants US-made vaccines for itself. So my question is, how would WHO formulate guidelines on the allocation of vaccines in the future to ensure fair access to pandemic remedies worldwide, especially for underdeveloped countries? Thank you.
All right, so that's that briefing there in Geneva, WHO having that briefing on maternal, child and adolescent health at a time of COVID-19. Interesting to hear credit given to South Africa there in terms of health care, particularly for children and adolescents. So I think credit to the health department, I suppose, in that regard. Well, that's it from us here in Nasrec, here in the south of Johannesburg. It's back to Auckland Park, where the full view with Griselda Lewis will take over and, of course, continue with that briefing for you from the WHO. Please do have yourself a lovely weekend. Stay safe. Take care. Cheerio from myself, Flo Ledwaba, and all of us here. Bye-bye.